Welcome to this video about the maintenance of luxating instruments. These are stainless steel, single-shanked instruments used to help extract a tooth. Traditionally, they have a handle, shank and working tip. This working tip is curved in shape to fit around the root of a tooth. Its convex surface is beveled, creating a thin, fine, sharp working edge. Luxating instruments need to be sharpened to maintain this beveled tip. The instrument is therefore efficient and effective at cutting the periodontal fibres, minimising trauma, allowing quicker healing and preserving bone and anatomy. For your work area, you will need a flat surface, a source of light and, if possible, magnification. The equipment required includes a standard PPE, testing stick, sharpening stones and lubrication liquid. There are a variety of stones to choose from. We will be using a flat ceramic stone and a cylindrical finishing stone. Both have a fine grit, perfect for routine sharpening. Oil or water can be used to lubricate the stones. Both prevent metal particles embedding in the stone and clogging the surface. Did you know all luxating instruments are periotomes, but only director periotomes are luxators? The name is trademarked. So we will be now sharpening a standard ash luxating periotome. You can assess if blunt by visual inspection. This can be done under a bright light. A blunt tip will have a very small or no bevel on that curved outer edge. It will appear shiny and may have wear facets. A sharp edge will have an even bevel and be dull under the light with no visible defects. If available, you can alternatively use a testing stick. A blunt instrument will slip over the plastic surface. A sharp one will grab and catch with minimal pressure. Assume a seated position. Sit straight with elbows at surface level. Direct your light to the workspace. Hold the flat stone firm with your non-dominant hand. With your dominant hand, hold your luxating instrument. Palm on the handle with your index finger along the shank, pointing towards the tip. This is the same positioning as for an extraction. Apply several drops of lubrication liquid onto the stone. Place the curved outer edge at 45 degrees to the stone and stroke a smiley face. Make sure to rotate the instrument to sharpen the whole surface. Hold the cylindrical stone in the palm of your hand. Place the inner surface of the instrument tip on the stone and firmly stroke down. Lift and replace. This sharpens the wings of the blade and removes any burrs and nicks. You can reassess the sharpness with the testing stick. The blade will catch easily on the surface. For director luxator, use only a director supplied cylindrical stone. Assess the tip is blunt. Stabilise and position. Wet the sharpening stone with lubricant. Place luxator tip on the stone at 45 degrees and pull down. Repeat this until sharp. Remember, a sharpened luxating instrument is more efficient and effective, making the extraction better for both the operator and the patient. A good sharpening technique is important to keep the tip functional. Sharpening little and often is key.